really attracted me was the integration of a science background with great human skills of dealing with people in a very friendly, compassionate way. It looked like the perfect balance between technology and a strong interest in providing some sort of service to people. I'll always remember an elderly woman with very, very advanced chronic obstructive pulmonary disease who was on oxygen by little nasal tongs and had a permanent tracheostomy to help support her lung capacity. And she would intermittently unhook her oxygen, put the little catheter aside, turn off the oxygen, and then she would take out a cigarette and light it. She would pinch her tracheostomy opening and put the cigarette into the hole, and you could see her diaphragm move as she sucked cigarette smoke right through her tracheostomy hole before finishing and then resuming her oxygen. That was an enduring image of the incredible tenacity of what for her was a truly life-endangering habit. For years, doctors had somehow been reassured that smoking may be beneficial for your brain. There was some early evidence that nicotine might mitigate or reduce the risk of dementia. This has all been set aside with the recognition that most of those studies emanated from the tobacco industry. Enhancing the motivation for some older smokers is a recent appreciation that not only is cigarette smoking an adverse risk factor for vascular disease, for chronic lung disease, for the risks of lung and other forms of cancer, we now know that cigarette smoking at a significant level of intensity, roughly 40 pack years, represents an increased risk of 70% for Alzheimer's disease. The starting point with any patient who is smoking should be one of sensitivity to the fact that, by and large, the majority of people who smoke actually want to quit. Somebody who comes in for high blood pressure, but you notice in his sport coat a package of cigarettes. I think a physician would be remiss not to say, while you're here, let's at least take a moment and consider how you're dealing with the need to stop smoking. I think you realize how significant that is in terms of your overall health. Address that maybe briefly, but not neglect what may be an important problem. Just as we sometimes take a person with unacceptably high blood pressure and say, you're going to the high blood pressure clinic, I'm making the appointment for you right now. You have evidence of serious cognitive impairment. I want you to link up with Alzheimer's Association right now. You have a definite problem with smoking. I think you should link up with 802 Quits by way of my secretary right now. I think that should be automatic. That should be part of our behavior to be sure that what we're talking about is translated into direct action for the patient. It can be a pretty straightforward interchange in a patient that you know from previous visits and have had a good rapport with. It can be as simple as, Frank, I want to know how you're coming with work to try to eliminate smoking as one of your health problems. Just give me an update here, and I want to do everything I can to try to support you. This doesn't have to take long, and if you focus on the patient and express your concern about his trying and hopefully succeeding in eliminating smoking, that's a very good starting point. It shows support, it shows that you care, and you reach out and say, what more might I do as your physician to help in this regard? That can be done in a minute.